Okay, hi everybody. I am super excited to join you this evening, this morning, or this afternoon, depending on where you are around the world, to talk with a gentleman who clearly has our best interest at heart in helping us to uncover the hidden damage. What is it that is making you fat, sick, tired, or any of those combination of those symptoms? We're going to talk about that today. Very, very important stuff. I hope you have a piece of paper. I hope you have a pen. Get ready to take some notes. And it's my pleasure to welcome onto this presentation with me the founder of thedoctor.com and the author of The Autoimmune Fix, Dr. Tom O'Brien. Dr. Tom, thanks so much for being here today. I'm excited.
Oh, thanks, Ridgely. It's really a pleasure, and I look forward to talking about this with you.
Well, what we're going to do is we're going to kind of start at the beginning, and I'm going to take the role that all those people out there that are watching this presentation know about as much as I do, which is not a lot. And so if it sounds like we're asking kind of goofy questions, please forgive us, but I want to play that person's role that's watching this, that's saying, what does that mean? Wait, hold on a second. Wow, that's a little shocking. Ooh, that's a little whatever, jarring. So before we get started, what are diseases? Could you name a few of the diseases that are linked to autoimmunity?
Oh my goodness, yes. Alzheimer's, Parkinson's, cardiovascular disease, strokes, diabetes, multiple sclerosis, psoriasis, rheumatoid arthritis, lupus, scleroderma. The list goes on and on and on. There's over 70 recognized autoimmune diseases and over 300 autoimmune spectrum conditions that have been identified so far.
And we'll get to that in a minute. So before we go any further, because I really want people to, I was one of those people who, until I began to read your incredible book, which got me transfixed and kind of locked in, really didn't understand. And I'm thinking that there are people out there that are in the same boat as I thought I was kind of aware, and I really wasn't. What is autoimmunity?
Autoimmunity is not a bad thing. When you grab a barbell and start pumping iron to build up your bicep muscle, you're actually tearing down muscle fibers. We're breaking apart. It's called micro trauma or micro tears. And when those cells are damaged, torn, your immune system has to come in and get rid of those old damaged cells to make room for new cells to grow. Mm-hmm. So the next day you're sore from it, there's some inflammation in there. But what happens is you build more muscle tissue. Well, you can't build more and stronger muscle tissue unless you get rid of the old damaged stuff that's there right now. Mm-hmm. And so autoimmunity is very natural, very common. It's essential for our growth and development from a body point of view. The problem, and if you do a blood test looking for the antibodies, which is the immune system's way of getting rid of the old damaged cells, if you do a blood test to look at antibodies to your thyroid, for example, there's a normal level, it's called the reference range, that you should have of thyroid antibodies. That's the normal for an adult, or there's a normal reference range for children. That's fine. But when you have an elevation on a blood test, it's an H or it says high. When you have an elevation of those antibodies, you're killing off more thyroid cells than you're making.
So you're killing your own thyroid.
You're killing your own thyroid. Now, you don't feel that when it's happening. So I'm going to make up a number here. I'm going to make up the number and say that there are 30 million cells that make up your thyroid gland itself. I don't know how many there are, but let's say it's 30 million. And if you're killing off, if you have 500 cells a day being killed off more than the reference range would be for your age and your weight and all that, if you have 500 cells a day being killed off more, you don't feel that. You've got 30 million cells. What's 500? Mm-hmm. And in a week, that's 3,500. That's nothing to 30 million cells. And in a year, 3,500 times 300, I don't know what the number is, but 900,000 or something, that's still nowhere near 30 million. You don't feel it until some point on the path of all this. Now you've killed off enough cells that your thyroid's not quite working the way it should anymore. And when it doesn't work the way it should, now you start getting some early symptoms of thyroid imbalance, such as cold hands and feet. Some people wear socks to bed, or your wife or your husband says you got cold feet in bed. It's hard to get up in the morning. You wish you had 20 more minutes in bed. Hit the snooze a few times. You can't lose that last 5 pounds, even if you don't eat for a few days. Signs of a thyroid imbalance going on. Now, you're not sick, and you notice that over the year or 2 years, that's getting a little bit worse until eventually you say, well, something's not right here. I don't feel right. You go to the doctor, they do a blood test, and they see, well, you got a problem with your thyroid. But it's been building up over a period of time, usually years, of the imbalance where your immune system is acting stronger than what's in the reference range. And you're killing off your thyroid.
Which means it's acting stronger than your own ability to rejuvenate the cells? Is that
exactly right? So you're killing off more cells than you're making.
Right. And so it accumulates, and as this grows and grows and grows, you start seeing little things, but nothing all that serious, until one day you reach a point where it's kind of like the wave is growing. It starts to crest over, and now you're having bigger symptoms. Is that what's going on? Kind of like the last straw?
That's exactly right. And that's a term I often use, the last straw. When you hit that last straw and you cross that edge, now you start feeling something. And you kind of live with it for a while. You might live with it for a year, a couple of years. You put on an extra 10 pounds in the last year. You don't know why, because you're not eating that much, or just getting a little, you hit the snooze every 2 or 3 times in the morning, whatever the symptoms are. That's just thyroid. If it's your brain, you say, oh, I'm getting old. I'm not remembering the way I used to. Ha ha. And you say, well, how old are you? Well, I'm 34. No, that's not supposed to be happening. That means there's something not working right when that's happening, right? And so autoimmunity is not a bad thing, but excessive autoimmunity is a bad thing. And it's actually the mechanism that's at the baseline causing most of the diseases we suffer from today.
So what you're saying is that our own body is actually causing the problem because of an imbalance in that range in some way. In other words, we detect something, and our own body goes after that thing and does it with such ferocity that we're actually doing more damage than good in that sense. Is that right?
That is correct. And just one caveat, it's your body trying to protect you. It's not a body that's gone haywire like Girls Gone Wild or something. It's your body trying to protect you. Let me say that again. It's your body trying to protect you.
And it's becoming overprotective. So
it's being essentially protective. There's a overreaction, but it's not turned on working too hard. There's a reason why it's working so hard. It's not excessively working more than it should. It's working to protect you most of the time. That's the problem here, is that it's trying to protect you. So the question is, what's it protecting you from? And that's what the book is about.
Well, tell me, so first of all, why don't we know about this? Why is this so uncommon in the knowledge of thinking people, of which I try to consider myself one, who halfway pays attention? I eat what I'm supposed to eat, I think. And as I'm reading this, I'm thinking, no, I don't. I really don't know what I'm eating a lot of the time. Why is this such uncommon knowledge?
In the discussions you and I have been having, Ridgely, it really, I feel validated to be as outgoing as I am to carry this message out, because you're a very smart guy. I've had a chance to meet you, and you're a very healthy guy. You do everything you can to be healthy, and you had no clue about this stuff.
That's right, none.
Yeah. And you read this and you say, my God, this makes perfect sense. And he's got the science here, and this is not my idea. I'm just the geek that reads the studies. And when I read the studies, I say, holy cow, this makes sense. And so I put it together in the book, but I'm just quoting all of the different studies, not all of them, but many of the studies that I've read over the last 30 years. And the question as to why is this happening?
Well, can we talk about just 1 second before you go any further, because before we go to why this is happening, because thyroid doesn't quite bring it home as maybe some of these other conditions that happen out there. How does somebody begin to develop Alzheimer's or dementia? And tell me, but let's bring this home for everybody that's watching, because I don't know about anybody else out there, but I'm scared.
Yeah.
I just want to tell you straight out, I'm scared of that. My grandmother passed away from dementia. It was horrendous. And I heard it skips a generation. So that would mean that I'm in line. And I want to understand this. How does that happen?
Well, that's really an important question. That's the million-dollar question. And, there was a Newsweek cover story. I think it was in 1994. I think there was a cover story. It was called "Fixing the Brain," and I took a picture of that, and I made a slide out of it for my lectures to doctors. And I say, notice it didn't say "getting by on what you've got left of your brain." That the title was "Fixing Your Brain," and in there, one of the quotes that I put in a slide was, "Scientists have known now that Alzheimer's is a decades-long process with multiple steps along the way. And the technology has improved so much now, we can identify many of the mechanisms that set all of this up. And so you can see ahead of time." I'll give you the example. Dr. Dale Bredesen runs the Buck Institute at UCLA. That's the Alzheimer's Research Center at UCLA, obviously one of the best in the country. He published a paper in November of 2014 in the medical journal Aging, and it's free online for everyone to get. So Bredesen is Bredesen, Dale Bredesen, and in the journal Aging. And he completely reversed Alzheimer's in 9 out of 10 patients within 5 years.
Wow.
If they could no longer work, they were able to go back to work. If they could no longer live with their family, were in an institution, they were able to come back and live with their families again. That they were functional. And it's a 34-point checklist. Do they have this? Do they have this? Is this mechanism going on? Is this mechanism? If it is, fix it. If this mechanism is going on, fix it. If this mechanism is going on, fix it. There is never going to be a drug to fix Alzheimer's. There are imbalances in physiology going on that are mechanisms that kill off cells, until you've killed off enough cells that you say, I'm getting old, I'm not remembering the way I used to.
Mm-hmm. Mm-hmm.
So there's a mechanism here, and that's true with all of the degenerative diseases. But you hit it right on the head. The one that people are most afraid of, if someone has a heart attack and they survive, they know that if they clean up their diet and they exercise a little bit, they're likely to be fine for many years to come. If someone, God forbid, gets cancer and they go through therapy and they put the cancer in remission, they know that they've got time. But what if you're diagnosed with dementia? That terrifies all of us. It just terrifies us. So the message in the book, and my entire message to get out to the world, is there are mechanisms going on that are under the surface while you still feel fine, but inside you're killing off cells, until eventually you've killed off enough cells. Now you start getting some minor symptoms.
Mm-hmm. And what by extension, what you're also saying then is, if you could determine what those mechanisms are, if you could determine which of the antibodies are out of whack, so to speak, using layman's terms, right? You could make changes now to enable you to not only prevent further deterioration, but even potentially reverse some of the damage you've done.
Dale Bredesen proved that. Dr. Bredesen proved it. Yep, that's exactly right. Exactly right.
So, you know me, I'm just a good old country boy, got to ask the funky questions. I mean, is the reason we don't know about this some kind of conspiracy, or is it just ignorance?
No, it's neither. Your doctors have been trained. Our doctors today, here's the easiest way I can think of to say it. The Dean of Medicine at Stanford Medical School a few years ago gave the commencement address to the graduating class of Stanford Medical School. And it was such an incredible address that he gave that they published it word for word in the New England Journal of Medicine.
Wow.
This is what he said. He said, "Congratulations. We're so proud to tell you that you are some of the best trained diagnostic physicians in the world. You've been trained on the cutting edge therapies. You understand how to use the most sophisticated equipment. You know what tests to order in order to identify the disease that a patient has. But we have to apologize to you because we have not prepared you to go into practice. You are the best trained physicians, some of the best trained physicians in the world to deal with a crisis that comes into your office. Person has a heart attack, person has dementia, whatever it should be. You are accurately able to identify what they're suffering from. However, 78% of what's going to come into your practice is not crisis care. 78% of it is chronic disease, symptoms of chronic disease, and we have not taught you how to address chronic disease. To address chronic disease, the visual that I like a lot is that when you've got symptoms building up over time, they get worse, and you've fallen off a waterfall and you've crashed down into the pond. You're still alive. You're trying to get through the symptoms. You're trying to, survive in the midst of these symptoms. You've got, what do I do to feel better? What do I do to feel better? And our doctors are trained down in the pond. But where we have to go is back upstream. What fell into the river that eventually caused you to go downriver and fall over the waterfall?
Mm-hmm.
That's what the term going upstream in medicine means. What happened way back here? Did you have multiple prescriptions for antibiotics years ago when you were a teenager for acne, for example? Now you're in your 30s and you've got lots of gut problems. And no one's asked the question, what happened to you as a teenager? Did you have acne? Or did you take prescription drugs as a teenager that could have altered the good guys in your gut, which may be causing the gut problems you have now? You have to go back upstream to figure out, why do I have trying to survival right now? Why do I have these symptoms that I'm trying to understand and get rid of the symptoms? You cannot focus on getting rid of the symptoms. Of course, we want you to feel better, of course, but you don't focus on that. What you focus on, how do I get the symptoms down, and where in the heck did they come from? What happened up here?
Right. And then so we have the most expensive healthcare system on planet Earth.
Yes.
And yet you're saying that the people who are supposed to be in charge of helping us out to feel better don't know how to even look for what's really going on.
Well, it turns out it's not a healthcare system. It's a crisis care system. And it's a really good crisis care system, but it's not a healthcare system. Everybody waits until they're in crisis to go to the doctor. Mm-hmm. What if you treated your car that way?
Yeah, you'd be in crisis in your car fairly frequently.
The car would be in crisis. If you don't take it in for tune-ups and adjustments and things, the car would eventually fall apart or would have some problem that develops. We don't treat our cars that way, but that's how we treat our bodies. We are taught to only deal with when you have a symptom.
Mm-hmm, mm-hmm. And so what do we have to do then? Where do we even begin to reverse this behavior that is frankly making us not only very ill, but potentially damaged for life? I mean, but the ramifications of not paying attention are so staggering.
Yes.
That any thinking person that is watching this right now has got to be saying, okay, Dr. Tom, great, thank you. Now what? I mean, I know any thinking person is doing that, right? I don't want dementia. I don't want cancer. I don't want lupus. I don't want any of that stuff. Where do we even have to begin to shift our consciousness, and what do we have to do? That's a big question. That's a big question.
Einstein said it better than, and his concept really works for me, and that is that the problems we've created today cannot be solved with the same level of thinking that caused the problem. Mm-hmm. We have to up our game in terms of how we think about everything, about our health condition. We have to up our game.
And
So
what is
we
that?
have to get educated. And that's what the book, The Autoimmune Fix, is about, is what is this mechanism? What is this concept of looking upstream? What is it that goes in the stream up there that eventually causes me to fall over the waterfall? What is that?
Now, let me ask you a question, because let's just suppose for a second that someone begins reading the book and they start to get educated. So I'm learning a lot of stuff here, and I'm learning a lot of stuff, but frankly, it's pretty deep. I mean, this is intense. There's a tremendous amount of science here that is not so easy to digest.
Sorry.
And so, yeah, no. I mean, I'm just saying, it's one of those. It's rich. It's every page. I remember thinking, I think I mentioned to you in a conversation. I thought, oh my God, I must have read 85 pages, and I was on page 16, because my brain was, wow, I've got to take all this in.
Yeah.
What do you say to the ordinary person that's thinking, okay, I care about my health. How do I start understanding this? What is my first step? How can I take one tiny, the journey of 1,000 miles begins with a single step. What is that number one first step?
Well, I'm glad that you did this, because this is a slide that I start most of my lectures to doctors with. And it's a display in the, I have to pause for a minute, Ridgely. I have my physical therapist is outside the door.
Okay.
I think I forgot that I have her scheduled. So let me go get her, and then we'll figure out what to do here. All right.
Okay. And I can keep talking in the meantime and share some more stuff with people. So please go ahead.
Okay.
So watch Dr. Tom run away. This is very cool. So what happened to me when I first began reading this book, and I can share this with everybody, was that my eyes were opened, and at the same time, my level of fear, my level of angst went through the stratosphere, because I realized how little I actually knew. And as I continued to read, my education level went up. It caused me to have an even greater level of anxiety, because basically I didn't know not only anything about autoimmunity, I did not understand how the things that I'm putting into my body, which are likely some of the things that you're putting into your body, affect you in a negative way. I certainly thought that many of the quote unquote healthy things I was doing were supposed to keep us healthy. And it turns out that that's not at all the case. Rather, it depends on each individual's situation. What condition are you in? What does your body tell you that you need? What is your background? What is your environment? What are the toxins that you deal with on a day-to-day basis? All of those things apply to any one of us to create literally a different condition for each of us, a different situation for each of us. So for me, when I had the opportunity to say, Tom, can we get online? Can we just put something out there to share with people really what this is all about? Yes, on the one hand, it's about saying, hey, I think this is a great book to read. And I'm going to tell you that it's complicated. And I'm also going to tell you another thing that I found, which is this. I don't want just the book. I want more, because I want a community, a support system, a something. If somebody says to me, you need to stop doing this, and insert the blank. You need to stop eating milk chocolate. Okay, great. You need to stop touching wheat. It's really bad for you, or whatever. Somebody says that, and you say, you know what, as Tom was saying earlier, I don't feel so bad right now. I'm okay right now. Maybe it'd be okay to do a little bit. But what this is telling me is that, no, that's completely wrong. And you need a support system. So for me, I found myself thinking it's not enough to just do I'm going to read the book and I'm going to create myself a checklist. I also wanted to create a community, a group of people that could actually help me out in the process of getting to better health. So I think Dr. Tom is back now, and I was just sharing a couple of thoughts here with everybody that about what happened to me as I was reading the book. And what came up for me, and maybe we can just talk another 10, 15 minutes about this, Tom, is that I felt that in addition to the knowledge that I know you're sharing with us on your lectures, on the radio that you're doing all the time, I felt that I needed or would need, as I'm just beginning, frankly, this journey with probably many of the people that are watching right now, I needed a support system, man. I mean, I need somebody I can come back to. I need somebody I can check in with.
Yeah, that's a really good point.
It's not so yeah, okay, here's the information, great, here, knock yourself out. Well, wait a second. Well, where's my people saying, no, bro, don't eat that wheat if that's what you have a problem with, or don't touch that milk chocolate if that's what you have a problem with. By the way, you can take a square of dark chocolate and put it under your tongue, which I've been doing every day now because you told me to. What about that? What do you think is the importance of a support system to help people when they begin on the journey back to optimal health?
It's critical. It's critical. The entire world of your social network is critically important in your success in changing lifestyle. And that's a big concept. I don't want to change my lifestyle. I'm fine. You know, we'll do this kind of a response to that. But it's critically important to have a support system. You further ensure your success by having others who are sharing the journey with you or who are clearly supportive of what you're doing.
Well, you know what I find? I find that not only do I want people that I can, for lack of a better term, complain to a little bit if it's hard, so that I feel like I'm not the only one that's out there suffering going through that, right? I also want someone to celebrate with, right? To say somebody, so that somebody has a big victory, then it's encouraging to the rest of us to say, okay, man, keep on going. You're going to be there. You're right behind me, all that kind of stuff. How have you seen that apply to the folks that have had a chance to see you personally, become a patient of yours, and start down the track toward better health?
Oh, it further ensures their success, and they feel acknowledged and supported, empowered. Empowered is the word. Mm-hmm. They feel empowered. They've got more power inside to continue working to be healthier.
Well, especially in this society that we live in that is largely a take a pill society, right? Oh, there's a pill for that. Oh, there's a pill for that. And then all of a sudden you're doing all these things. And aren't we then going right back to the symptoms and not actually going upstream enough to solve the problem?
You know, we're programmed from birth to this. I mean, did you ever think about, we call it a medicine cabinet in the bathroom?
Mm-hmm.
Why is it called a medicine cabinet?
Because it's got medicine in it.
Shouldn't it be a nutrition cabinet or a makeup cabinet? But it's called a medicine cabinet. So we're programmed from very early to just accept, well, I'll take my medicine, and I'll take this pill for this, and I'll take this pill for this, and I'll take this pill for this. Mm-hmm. And there's nothing wrong with pharmaceuticals, absolutely nothing, for a short term. You know, all of the medication, I shouldn't say all, that's an exaggeration. The vast majority of medications that have been approved for use in our country today have been approved for short-term use, for a specific symptom, not for long-term chronic maintenance. Mm-hmm. And yet we take them for long-term chronic maintenance.
So let me bring up one other thing here, and we'll do a couple other points. And I want to invite everyone that's watching this to please make comments, share your stories, ask some questions. We're beginning the process of building an incredible community toward health. Tell me about this concept. How do you respond to this? And Dr. Tom does not know what I'm about to say. It's just fresh right out of here. Yeah. The body never lies. Tell me about that.
You know, that actually was a logo that my mentor taught us 38 years ago. Body language never lies. Some people speak French along with English. Some people speak Spanish along with English. Some people speak Portuguese along with English. Very few people in our country speak body. Mm-hmm. But body language never lies. Mm-hmm. It's just a question, do you know how to read the dashboard of your body? Do you know how to read what's going on? Your body will talk to you. But we think that if we don't have symptoms of dysfunction, then there's nothing to pay attention to. Absolutely nothing. And once again, that's like if you treated your car that way, if you waited until your car didn't run very well before you took it into the mechanic, it won't last very long.
I think it actually applies to almost anything, right? It applies to your refrigerator. It applies to your vehicle. It applies to your body. If you are an athlete and you stop training, at least athletes have some semblance of recognition. Guess what? You will not be able to do what you used to be able to do. In other words, you will not be able to perform at the same level. So what you're saying is if we ignore this mechanism that we live in and don't pay attention to what's really going on inside, what you can expect is that there are going to be imbalances and that your immune system is going to kick in not in the best possible way for your long-term health.
And that's exactly what happens. We started off this discussion about Alzheimer's. It's a decades-long process with many steps along the way. You just don't feel them. You feel fine, but inside, all these things are cooking. All these things are going on.
Unbelievable. So I know we're going to have a chance to circle back and talk about a lot of things as we move forward, helping to share this message of, wait, you really need to do something with your health. And what would you say to the people that have, in a sense, had an experience similar to mine, which was a wake-up call? In other words, I started talking to you, and what happened to me was, oh my gosh, I thought I was smart, but I wasn't. And enough of a wake-up call to say, all right, let me get more educated. Let me pay attention to what Dr. Tom has to say. What do you say to those people that are getting a little bit of a sense of that wake-up call right now? As we're closing out this, what would you say to them?
This finger that you held up earlier, this one thing. I use a slide when I'm lecturing to physicians, and it's a picture of a display in the Museum of Science in Florence, Italy. The display is Galileo's finger. And Galileo, and if you go to Amazon, just type in Galileo's finger, there are a couple of books about this. And he, in his will, he said that all of my inventions can be on display for all of posterity, as long as you also display my finger. Now, it happened to be his middle finger. And that was Galileo's last message to those that fought him about his theories. And so, but I like this finger because what it says is one thing. If there's one thing you do, and I use this with physicians because they're so busy in their life, and that is 1 hour a week. I take it as 1 hour a week. If you take 1 hour a week to learn a little bit more and apply some of these principles, in 6 months, you've got this down. That there's no way to change the way you think, to change how you look at taking care of your body, to change how you look at what's on the end of the fork. It's not going to happen from reading a book. At least I've never experienced that. I may be motivated to try and make some changes, but when you take your time and you do 1 hour a week, you learn a little bit more here and a little bit more here and a little bit more here, and you research this and you look for this validation. Oh, that made sense what he said. Oh, that paper that he talked about, it really does say that. And you take 1 hour a week in 6 months, you are on the path, you've got it solid, you're locked in, you know where you're going, and you're seeing the results. I think that's the way to be successful.
Well, thank you so much. I want to invite everybody again, please leave your comments, your thoughts, your questions. We will be reading all of them to figure out what we're doing next. And I think, I'm not going to tell everybody what it is, but I think the next time around, we're going to go and take a look at an example of what can literally reverse your healthy, incredible, vibrant body and take it downhill, just like Dr. Tom has been talking about for the last half an hour on this presentation. Again, please leave your comments for us, leave your messages, your questions. We will check all of those out, and we're going to begin to build a community of health. Any final words out there? Final little tip for people, Dr. Tom?
Be patient be persistent, be on track, and you'll be great.
Thank you very much. Thanks everybody for all of your time. It is very precious. We only have so much of it. We also hope that with this work, you're going to be able to gain the best possible health to lead the best possible life that you can. Thanks everybody.